This is not what Mark Baskett expected one day 3 years ago. It was a beautiful April day. Mark Baskett and his girlfriend were on their way to a family picnic. Then it happened.
She took her eye off the road just a matter of seconds and found out she was in the wrong lane.
She collided with an oncoming car in a horrific crash.
And they thought at first that Mark was ejected because they couldn't find him. The dashboard and everything was crushed into his side.
Mark's condition was critical. He was airlifted to the trauma unit at Grady Memorial Hospital. His parents weren't far behind.
We got to Grady to tell him goodbye. Was basically our goal.
Doctors told the Basketts that Mark was in a coma and showing almost no brain activity. His score on the Glasgow Coma Scale, a measure doctors use for assessing brain injury patients, was just 4 out of 15.
A Glasgow Coma Scale, or GCS, of 4 is very close to death. It's 1 point off of not having any brain activity when you come in.
But the Emory doctors at Grady did offer one ray of hope, a chance to participate in a clinical trial designed at Emory, testing the use of progesterone to treat traumatic brain injury.
We really had nothing to lose. Mark, in our point of view, was 1 foot in the grave and 1 on a banana peeling.
The use of progesterone to treat traumatic brain injury is an approach discovered and developed at Emory.
This is a really classic story of how something really starts at the bench top and goes to the bedside. This work started about 17 years ago.
That's when doctor and Emory researcher Dr. Donald Stein noticed that female rats tended to recover more quickly from injuries than their male counterparts. After isolating progesterone as a key factor, Dr. Stein began collaborating with Dr. David Wright, an Emory physician working in the ER at Grady.
And having a clinician working in the lab with them gave it, I think, a little bit more of a forward thinking. Okay, where are we going with this? What is the ultimate goal?
Our goal was to put it to work helping patients.
We wanted to look and see if there was evidence that it was working, that it was doing what it was doing in animals, which is where, frankly, most drugs fail.
But in this case, the results were dramatic. 3 years after the accident, this is what Mark Baskett looks like today.
I'm basically back to my old self, thankful for this drug.
He can do anything that he wants to do now. He functions just fine.
Not all the patients in the study showed improvements as dramatic as Mark's, but doctors are nevertheless excited.
We feel ecstatic. This could transform the way we care for head injury patients. It could be a dramatic improvement. Again, no treatment in 30 years. Literally no pharmacological treatment at all that can improve the outcome of these patients. And now we're on the brink of having something. That's pretty dramatic.
And the collaboration continues. We're looking at other uses for progesterone in patients with strokes and combat injuries.
But with the brain injury, you don't know what you're coming home with. And Mark got his laugh back, he got his sense of humor back. So he's a very strong-willed and a stubborn fella.
She hopes this innovative approach gets government approval soon so others, like her son, can beat the odds.